Welcome to the Heart of It, where we take our listeners to the heart of healthcare. I'm your host, Dr. Victoria Lee, and I'm thrilled that for our first season, we'll be speaking with some of the exceptional people at Fraser Health that are at the heart of healthcare. As we begin today's podcast, I'd like to start by acknowledging that we are joining you from the unceded, shared, and traditional territories of the Coast Salish people, particularly Katzie, Kwantlen, Coquitlam, Tsawwassen, and Samiamu First Nations, as well as home to Surrey Delta Métis Association. Today, I'm really excited to talk to our very special guest to talk about compassion as a superpower, Marika Sandrelli, who's our seasoned expert in our knowledge exchange leader in mental health and substance use services. Welcome, Marika. I'm so thrilled to have you today.
Thank you. And happy to be here. And just was mentioning earlier about how appreciative that I am that we're having this topic about compassion. And we were talking earlier about, even a few years ago, how this was something that was disregarded or seen as fluff or delegitimized. And yet here, it's one of the topics that you're going to be focusing on.
So would love to hear a little bit about how you've experienced compassion as a healing ingredient or just an ingredient in our own journey.
I had a chance while I was going to university to do some international work and ended up working on a project in Brazil and New Zealand as well. And there was another, there are people that stay with us, right? There are people that have become our guides throughout our life. And I met a Maori elder. They were working really hard at that time to establish their own governance over health. Yeah. They've been doing it for centuries. They succeeded eventually, but back then they were working really hard. And I'll never forget a time where he sat with a group of us and said, there's only 3 things in the Maori worldview that matter about wellness. And it's not like you have to have it or don't have it. It's a continuum. And so he invited us to think that every interaction that we have with someone, every decision we make, every policy we create, every practice guideline we create, if what we're doing shifts in these 3 areas, then we are promoting compassionate wellness. And I'll never forget them. So what they are is whatever we're doing, are we shifting away from oppression toward liberation? Are we shifting away from exclusion to inclusion? And are we shifting away from violation to love?
Beautiful.
So this was in the 80s. Yeah. And so his word stayed with me. And so you're right, it's been around for a long time. And I think that what's happened is, I think sometimes we become in more colonial systems. I think we have to quantify that in a colonial system, that we become so focused on the instrumentation of things. It's the what. Yeah. And the what is important. Don't get me wrong. The what is important. But I think we sometimes don't value as much that even though healthcare may appear like a inhumane big machine, it really is people as are at the heart. Yes. And it's a relational practice.
Yes. Yeah. And in fact, we often hear about that care experience. And what's positive about it is that care and compassion. Yes. When it's negative, it's often that lack of care, compassion. Absolutely. And often shows up as communication. But when you delve into it, it's that layer that we consistently see.
Yeah. I worked, when I first came to Fraser Health, I was lucky enough to work as a clinical coordinator at the Maple Ridge Treatment Center, which supports men with substance use disorder. And I remember one of the clients, he had come back a few times and I saw him and he was, said, "Hey, Marika, I'm back." And I said, and had a conversation with him. And I said, what inspired you to come back and join us? And he said, Marika, it was that security guard at Abbotsford Hospital. And I said, what was it about that security guard? And he said, he looked me in the eye. He took the time to talk to me. He said I reminded him of his son.
Yeah. I remember talking about, being worried that we're going to see a bit of a tsunami of mental health substance use issues after the pandemic, because we're social animals, we're, relational people. And that a lot of those things were taken away during that time. But then you add on the other complexities of today's world of economic downturn, growing polarization, social media impacts.
Yeah.
All
Planetary
of those,
health.
I know. So all of those together, like, how do you bring that compassion back into what we see on a day-to-day basis?
All these happenings happen, and I think we put our energies on changing what's happening on the outside. If we just can make this go away, if we can, here's a problem, let's fix the problem. Let's just make all this stuff go away.
Yeah.
And so, we're in already a crisis state, right? So I talk about healthcare sometimes, Sandra Bloom's work around healthcare as a trauma organized system. So what does that mean, a trauma organized system? We're in a trauma organized world right now. So what is that? What that really is that we can start, it's a parallel process. As people can experience the effects of trauma, so too can systems, so too can ecology, so too can the world. And we start mimicking that, which means we become quite fixated on the solution.
Yes.
And it's about identifying the problem. There's a problem. We don't want there to be a problem. Let's fix the problem.
Yeah.
And we're not at our psychological best in that moment. It's almost like we're constantly working in a highly stressed environment. And then eventually, some people say we even start pollinating crisis because we're so used to that way of being. So I think a compassionate response is necessary so we don't let the distress, kind of guide or inform our decisions, right?
Yeah.
That it's everything's an emergency and a crisis and we need to solve things right away.
Yeah.
And we don't take time to pause.
And as you said, it's much more comfortable doing in our culture than being.
Absolutely. Because it's painful. And I think, and it's the fight, flight, or freeze. But, in healthcare, there's also a fawn response. And I think our system and our healthcare system we tend to be in what's called a fawn response.
Say more about that.
Yeah, a fawn response is when we're feeling overwhelmed and our ability to cope or adapt isn't working. A fawn response is where we overfunction.
Yeah.
We overfunction and we become perfectionists. We feel that our worth is tied into how much we can do, how perfect it is. We do more instead of different. We just do more.
How do we then cope and grow and actually stretch? Because sometimes the most painful and suffering kind of experiences are the ones of most growth and
absolutely
stretch.
Absolutely. I think that, we just want the pain to go away. We don't want to acknowledge it. We don't want to pause. We just, and because we're in that chase, that elusive chase, right? And now with social media, like people are chasing a lot of illusions, like the illusion of happiness that you need to, have these things or look a certain way, or there's this kind of elusiveness that happens. And so people can get caught up in that quite easily. And so, to be still, and still, it's just even in a moment, in our workshops, we do trauma and resiliency-informed practice workshops right now, because we are a trauma organized system, and healthcare providers are care providers, and a lot of people that work in human service, we're exposed to a lot of secondary trauma and distress. People come to us because they're hurting, and we're in the business of alleviating suffering and connecting with people, and so really we have a responsibility not to re-traumatize, but also to reduce the effects of trauma for people as part of alleviating suffering. And so TRIP is that practice. And we've really discovered quite a bit what makes TRIP so different. And it's a Fraser Health program is that it really looks at how being exposed to trauma and working in a traumatized system is this idea about looking inward in the moment before looking outward. So there's a theory of change that we've developed where we've brought in mindful self-compassion.
Yeah.
So basically the theory says you can't give what you don't have, you know? So this idea about the more that I can turn inward and say, and attune to what's going on to me in this moment. It's not so much about self-care after, in the moment when things don't go as planned, where a patient is in a trauma response and they're throwing F-bombs around, or they're angry, or they're frustrated with us. In this moment, you know, just attuning, like, what's going on for me in this moment, and what do I need to do to stay open, receptive, and connected to this pain and suffering.
Yeah.
And that's really what TRIP is about. It's about, you know, the mindful self-compassion, the compassion for others. And what's the beauty that we've discovered is those two converge into this beautiful phenomenon called compassion satisfaction, which I learned about a decade ago. It's one of those other things that stays with me. So compassion, we've heard about compassion fatigue. You know, we hear about that quite a bit. And I often say, I don't really like that terminology because there's nothing fatiguing about compassion. Really, what's fatiguing is stress, right? And distress, right? So it's not really compassion. So this is an interesting way to look at this thing called compassion satisfaction. Well, about 10 years ago, I took a survey. It's called the Professional Quality of Life Survey. And I was interested. I'm always fascinated on how people that work in highly traumatized environments, how do they stay compassionate? This has been 40 years of a curiosity. And so I took the measurement, and I scored really high in this thing called compassion satisfaction. And I'm trying to wonder, what is this all about? So what it is, and I think it's the reason why I've been able to stay and work with people who are really suffering for like over 40 years. I've scored high in this, and it kind of makes sense. It is compassion satisfaction. When you score high in it, you're less likely to burn out. You have high scores in resiliency. You do. You're less likely to project your stress onto other people. But what it's characterized is you have consistent, authentic, positive work relationships that you can co-regulate with. They truly understand your pain and suffering, and they get you. And you get them. So that's really important to have in our healthcare system. It really is.
That teamwork.
Yeah. And something I know you're investing in, a lot of leaders are investing in. So that's beautiful. The other thing is, when we come into healthcare, we're mission driven. Sometimes there isn't a policy or legislation that can be more powerful than our mission, right?
Exactly.
Like it's very powerful. So when we need to feel like we're making a difference. So compassion satisfaction is, you can see the difference you're making, even if it's measured in millimeters or not miles, right? So you can go home. I remember working at the treatment center, and there was a client who never made eye contact with anyone, had a hard time. And I remember coming home and like high-fiving a colleague and saying, he looked at me today and smiled. You know, it was like one of those big moments, right? So, you know, that you can find those accomplishments, right? And sometimes you can do that in teamwork. And the third thing is that there's meaningful, that you feel things are meaningful, right? That you can find meaning even in the mundane. That you can connect it to connect it to what I'm doing. You can connect it back to, I'm alleviating suffering. I'm connecting with people who are hurting. Like you can see those connections, right?
That purpose, vision, values.
Absolutely.
I think that
values alignment. What's meaningful. So, you know, positive work relationships, being able to articulate accomplishments, even though they're small, like those are important, because it really is the confluence of people and actions that actually heal and promote wellness. It's not one person, is it? It's never
No,
is.
never. Were you always high scoring on compassion satisfaction, or did it take some learning and practice and over time? And I imagine it's also dynamic that you're not in that state forever, but you would move in and out as well.
I think like most people, it developed. I really think. I think that, I'm a white settler in a colonial system. And I think that, when you first start out, very ego driven at that time, when I said, okay, I've seen all these people that are living on the street. I want to go work and change things. And it was, I'm going to do this. I'm going to change things. I'm going to pose this. I'm going to resist. I'm going to do all this stuff. So it's very egocentric in a lot of ways, right? So it's like, so I think, that you kind of learn that, being oppositional isn't necessarily effective, right? I have this banner in my office that says, would you rather be right or effective? Yeah.
You talked about what kept you at Fraser, because you've been here for 20 plus years, right? What brought you here I guess over 2 decades ago now?
I'd been working in the downtown east side, and working with women in the sex trade that were injecting drugs. It was in the HIV and AIDS movement, and trying to and do needle exchange work, and then when you work in community, you see big institutions like health authorities as sometimes the enemy, or that they're oppressive,
bureaucratic,
they're
slow,
all this stuff. So I remember, and I used to think that way too, and even 20 years ago, and then someone said to me, Marika, like, why don't you go work for a health authority and change it? And and I thought about it. I had a job lined up. Again, I was going to go back to do some work in the Sudan, and then I thought, you know what, like, there's a job coming up. Someone said, I think they'd be interested in the work. They want to redesign their treatment model and become more kind of holistic and community-based. And so I thought, I'm going to go there and I'm going to change things. Like that ego came in. Like, I'm going to go there and I'm going to change the system. They need to change, I'm going to, it kind of reminds me now, as we're talking about my mom saying, Marika, you have to learn the rules before you break them. Those things. But as soon as I got in the system, like, all my assumptions and bias were challenged. I met people that worked in Fraser Health that totally weren't congruent with my assumptions, because it's people. It's really people. There were people that I met within the first few months that had the same mission, the same values, and were working and really understanding the pressures and the external factors. And so all those relationships were created a lot with that values alignment. And I really had to rethink a lot of my assumptions and biases, I think. And I think that happens to a lot of us, right?
And you've mentioned that global work that you've done, and you've worked all over the world. You mentioned Brazil, but other parts of the world and nationally. Are there themes that you see in the work that you do that you bring to Fraser Health, but also themes that you see that you think that more could be done?
I had a practicum in Moose Factory in Moosonee, so in Northern Ontario, with the Cree people. And one of my assignments was to go up to Attawapiskat, which with the Attawapiskat people in the Cree Nation. And I went there, and my job as a practicum student, so here I was, someone from Toronto, and kind of thinking I know it all, and, that kind of arrogance. And I went up and was supposed to do some work around substance use prevention in this community. And I followed everything that I was told, what I learned from the evidence about what works. I mean, this was like the 80s, and I followed the evidence, and nothing worked. because there are times where evidence is not enough.
Yeah. Yeah.
Right.
Yeah.
It was really, this whole piece was about, again, relationship, trust.
It's all about people.
Safety. It's all about people. And I remember I tried a few things. We had food. We booked a space for people to come to workshops. No one showed up. No one showed up. So finally, one of the elders, I think, took pity on me one day and saw this like white woman walking around looking so depressed and thinking she's going to fail her practicum or something. She took pity on me and took me aside and said, "This is what I want you to do." She said, "For the next 2 weeks, I don't want you to write anything down. I want you to put all the books, put your books away, put your pen away. I don't want you to talk. I just want you to listen. And I want you to come with me." And you're not allowed to write anything down. And that's a hard thing to do.
Yeah, especially as a practicum student. And
you want to do your best, right? You're so like passionate and committed and impatient in some ways. But that was one of the most amazing experiences. And I said, "But I won't remember anything." And she said, "But if you truly listen with your heart, you will."
Now, 40 odd years later, because you said it was in the 80s, you still remember that experience.
Truly listen with your heart, be fully present, really listen, like not just to what people are saying, but what they're not saying. And really just to be so present and so connected to another human being, you know.
There's also really great evidence that demonstrates that passion can be demonstrated and reflected in 15 seconds.
Absolutely. Absolutely. Like it doesn't take a lot of time. I think that's a myth. It really is in the moment. The thing is, the more you practice it, like practice doesn't make perfect. Practice makes practice.
Yeah.
Right? That's how we have to look at it. Like we're not going to be perfect at this. Like it's practice makes practice. But the more you practice, the more it becomes part of you. It's almost subconscious. So it's very much, it's seconds. I practice rain. Rain is an exercise. And really what it is, it's just to recognize what's going on without judgment. So that's the R. And then the A is to kind of attune to what's happening in my body, right? And usually when we're stressed out, we either hold our breath or we breathe faster, right? So being attuned to that. The I is to kind of investigate with kindness, like what do I need in this moment? And the N is to kind of nurture that awareness. So we walk people through in the trip workshop. So it's one of our exercises. And the more you do it, it becomes subconscious. Like, I practiced rain just outside of this podcast because I was a little nervous and I'm thinking, I'm holding my breath. Like, I don't think we're aware of how often we hold our breath during the day.
Yeah. And it actually drives that fight, flight, freeze behavior physically, because that's the way you're reacting, and the hormones then come into play as well. All
Absolutely.
Of the chemicals and hormones and etc. So that's a wonderful, in a few seconds that it takes.
It's like not even 5 seconds. And, Rain kind of usually we recognize the inner critic.
Yeah.
We all have an inner critic and it can get loud and it can take over. And when that inner critic, it puts us in a threat response. Like there's adrenaline and cortisol that gets released when we're thinking, when we have that voice or those thoughts that we're not good enough, or, oh no, why me?
Yes.
Why is this person always coming in on my shift? Or, you know what? I'm tired of having to spend all my time with this person. Like this kind of, and then the inner critic is like, because you don't know what to do. You're not good enough. You're not, you're not enough and all this stuff. It actually puts us in a threat response. And instead of oxytocin and dopamine, which is how we can socially engage, it's adrenaline, cortisol. It's a threat response. Yeah. So we can say and do things that are really harmful.
Yeah.
And because our need to protect overrides our need to connect.
It's a defensive protective mechanism. Evolutionarily.
Absolutely. It is really powerful. So I'll give you an example. Kirsten Neff did a study with soldiers returning from Afghanistan, and whether they developed PTSD, post-traumatic stress disorder, or not, wasn't the amount of combat that they saw. it was their self-compassion scores.
Wow.
Are they an inner ally
Yeah.
when things don't go as planned or when things are distressed, or are they an inner enemy?
Yeah. Oh,
So that's how potent this is.
yes.
So why wouldn't we in healthcare give everyone the skills to practice mindful self-compassion?
Of course.
Because it's in the moment, and it's whether you're a security guard, a housekeeper, a psychologist, a CEO, it doesn't matter. Like it's universal, right?
Yeah.
It's not profession dependent. It's not scope of practice. It's for everyone. It can unify us.
Well, I was going to get to the last question, but I think you almost answered it, but I will ask anyway. Well, for our listeners, what would be one thing that you would love for them to know that's about our health system?
If we can connect kind of with that kind of humanity, that common humanity, that I think that we can understand and support each other, I think that's really important. I think the other thing I want to say about healthcare, that it isn't just about caring people, but it's about brave people, that there are very brave people that work in healthcare. And we always talk about creating safe spaces or safer spaces. I don't really think there is a safe space for everyone, but I think there's brave spaces. And I've found more brave spaces in Fraser Health than probably in a lot of places in this world, where people are brave to be vulnerable. They're brave to change a practice that they've leaned on for many years, as long as we can support the cultivation of compassion satisfaction.
Beautiful. Well, thank you, Marika, so much for sharing some of your superpower with us and that knowledge and expertise. I know you don't love that word, but I feel like it's such a fitting word for what you've described and shared with us today. So I can't thank you enough. And we're very fortunate to have had you join us 20 years ago and continue to stay with us to continue to disseminate the love and compassion that we need to ensure that we have across our teams and the care that we provide.
Well, thank you. Thank you. Thanks
Thank
very
you.
much.
That's all for today on the Heart of It podcast. Join us next time as we continue to get the heart of healthcare. And please don't forget to subscribe and rate this podcast. The Heart of It is a Fraser Health production. I'm Dr. Victoria Lee, your host. Vanessa Wasno and Kevin Smith are our producers. Recording and editing is done by Fraser Health Communications and Public Affairs.